Hello. So, a very good afternoon to everyone. Grace, Vipul. So, today is our last day of our PYQ PYT edition series, and the remaining small miscellaneous topics we will be covering today. So, I hope you are revising them regularly. So you can ask any of your doubts if you are left with after listening to all those MCQs on Instagram, a Facebook channel of Pharmacology series with closed Medico group. You have already joined Telegram. This is the YouTube channel. And if you want to see this video, just tap on this video link or you can scan the code. Okay? So always share with your friends. Knowledge is for sharing. So let's start without wasting your precious time. Let's start the questions of respiratory, GIT, and Autacoids. Many question comes from this session. Okay. So first, let's start with respiratory system. Which drug is not used in the treatment of acute asthma? Remember, during an acute attack of asthma, we use a class of a drug known as bronchodilators. We use a class of a drug, bronchodilators. Logical. And there are four drugs which are bronchodilator. You can make a mnemonic Batman. B for beta 2 agonist, the drug that will stimulate beta 2 receptor in bronchus, and salbutamol is a beta 2 agonist. Then we have anticholinergic drugs which will block the receptors of acetylcholine on bronchus because acetylcholine normally produce bronchoconstriction. The drug we have is ipratropium. Then we have a drug which is found in tea and coffee like theophylline, aminophylline. They will end with the word phylline. And the last drug which is a bronchodilator is magnesium sulfate. That is why the answer of this question comes out to be montelukast. Remember, montelukast is a leukotriene receptor antagonist. It is not a bronchodilator, it is rather an anti-inflammatory drug. And anti-inflammatory drug, they are given for chronic asthma or prevention of asthma. They are not given in acute attack of asthma. Okay, in thyrotoxicosis beta, first drug to be started is propranolol beta blocker. Which of the following drug or beta 2 agonist can be given by subcutaneous injection? Anyone? Subcutaneous injection we give terbutaline. Terbutaline is given by subcutaneous injection. Now beta, all beta 2 agonists are given by inhaler. You can only give inhaler when a person has respiratory effort, person can breathe. You will give terbutaline subcutaneous injection when the person has in asthma sudden loss of respiratory effort. Sudden loss of respiratory effort means the person has suddenly broken down. Broken down means the person is having brittle asthma. This is known as brittle asthma. So in brittle asthma, we prefer to give terbutaline subcutaneous injection. Okay. Sangeeta ji, antimicrobial 1 and 2 part we have taken together. If you see the thumbnail of our video, you will find it. So we have taken all antimicrobials together in 1.5 hours. Okay. Which of the following is not an adverse effect of beta 2 agonist? So beta 2 agonist like salbutamol, formoterol. Formoterol now is the drug of choice for asthma. Remember, their side effect is 3T, 2H. Their most common side effect is they stimulate beta 2 receptor on muscles, which can lead to tremors. Tremors is their most common side effect. They also stimulate beta receptors on heart, which will increase heart rate. It will lead to tachycardia or palpitation. If you give beta 2 agonists continuously, their effect becomes lost. They show loss of effect. So loss of effect is known as tachyphylaxis. What is tachyphylaxis beta? Rapid loss of effect when we give continuous administration of beta 2 agonist. Now remember, they decrease potassium level in blood. They produce hypokalemia, but they increase glucose level in blood. They rather produce hyperglycemia. So can you tell me what is the answer? Beta, for brittle asthma type 1, we give terbutaline. For brittle asthma type 2, we give epinephrine. Okay. So I hope your doubt is clear. So it is not hypoglycemia, it is rather hyperglycemia. Fine. So which of the following bronchodilator drug itself sometimes can cause paradoxical bronchoconstriction? Remember why anticholinergic drugs they produce bronchodilation? Let me tell you first. So anticholinergic drugs like ipratropium, tiotropium, they produce bronchodilation because they block one receptor of acetylcholine, that is M3. They block M3 receptor of acetylcholine on bronchus. That is why they produce bronchodilation. But there is a drug known as ipratropium. Ipratropium sometimes can cause paradoxical bronchoconstriction. Remember, it is not seen with tiotropium because ipratropium also blocks M3. It also block M2 receptor on vagus nerve. Blockage of M2 receptor on vagus nerve will lead to more acetylcholine release, which will lead to bronchoconstriction. Another reason why ipratropium causes paradoxical bronchoconstriction is that its inhaler contains certain antibacterial preservative like EDTA and benzalkonium. You have to remember it was asked in NEET and INICT. This EDT and benzalkonium, they irritate bronchus and sometimes they themselves can produce bronchoconstriction. So what is the main mechanism of action of theophylline in asthma? So remember, theophylline produces blockage of adenosine A1 receptor. It causes histone acetylation. It causes phosphodiesterase inhibition. But its main mechanism of action in asthma is it inhibits phosphodiesterase 4 enzyme. It has been asked many times as a question. Because if you inhibit phosphodiesterase 4 enzyme, it will increase the level of cyclic AMP. Because phosphodiesterase enzyme degrades cyclic AMP. If you inhibit it, cyclic AMP level will increase, and cyclic AMP inside the muscles produce bronchodilation. So this is the main mechanism of action of theophylline in asthma. Okay, I think my volume is fine now. I have increased the volume. You want me to further increase the volume? Okay. Let me check if I can further increase the volume. So I hope now it's better. Durgaji, which of the following is least likely to result in increase in plasma level of theophylline? Remember, theophylline is found in tea and coffee. And tea and coffee, they are degraded in our body by an enzyme CYP1A2. How we can remember A? Theophylline is used in asthma. Some enzyme with the name A will come. Now there are certain drugs which are CYP enzyme inhibitor, and there are certain drugs which are CYP enzyme inducer. So which drug do you think will increase the plasma level of theophylline? The drugs which are CYP enzyme inhibitor will inhibit the degradation of theophylline and they will increase plasma level of theophylline, and we know the mnemonic for it, COK coke. So cimetidine is a CYP inhibitor, ciprofloxacin is a CYP inhibitor, erythromycin is a CYP inhibitor we discussed in general pharma. So the answer for this question is phenobarbital. Remember, phenobarbital is rather CYP enzyme inducer. It rather decrease the level of theophylline. It rather decrease the level of theophylline. So next is, which of the following adverse effect of theophylline is not because of phosphodiesterase inhibition? So remember, if you drink excess of tea and coffee, the side effect you will feel in your body will be the side effect of theophylline, because theophylline is a part of tea and coffee. So first let's write all the side effects of theophylline as a mnemonic suhag. So in brain, it can increase the risk of seizure. Now you know when you drink excessive tea and coffee, you have excessive urination or diuresis. In heart, the heartbeat increases because it can lead to arrhythmia. You feel heartburn, GIT upset, hyperacidity you see. So there is GIT upset, and because of cerebral vasodilation, they can lead to headache. Now remember the first two side effects, seizures and diuresis in brain and kidney respectively. It occurs because of blockage of adenosine receptor. Because they block adenosine receptor in brain and kidney, it causes diuresis and seizures. GIT upset and headache on blood vessel, it occurs because of phosphodiesterase inhibition. While arrhythmia on heart occurs because of both reasons. It occurs because of both reasons. So remember this part. Now can you tell me the answer of our question? Yes, the answer of our question is diuresis. I hope you have understood the basic concept behind it. So the answer of our question is diuresis. Diuresis is not because of phosphodiesterase inhibition. It is rather because of adenosine receptor blockage. So complications of inhaled fluticasone. Inhaled fluticasone is an inhalational corticosteroid. Inhalational corticosteroid, remember, they are the drug of choice for chronic asthma because it's an anti-inflammatory drug. Anti-inflammatory drugs are given for long-term treatment of asthma. And when a person takes inhaled corticosteroids, steroid deposits in mouth. When steroids deposit in mouth, immunity reduces and opportunistic infection can occur inside the mouth, and candida fungal infection can occur. So it can lead to oral candida infection, which is also known as oral thrush. You all know candida is a white fungus, so there will be white patches. There will be white patches. Now, what is a treatment of how to prevent this oral thrush if a person is continuously taking oral inhalational corticosteroid? Tell the patient to do gargles after inhalation and spit out this water. Rinse your mouth with gargle so that steroids are not deposited in mouth. And when a person is taking inhalational corticosteroid, tell the patient to use plastic spacers in mouth so that steroid does not get deposited in mouth. But if a person comes to you with fungal infection of oral thrush, so if there is a localized patch of white fungus, you in that localized patch, you can apply localized nystatin paint. Nystatin is an antifungal drug. But if it is a very widespread candida, let's say this candida has reached to pharynx or this candida has reached to esophagus, esophageal candidiasis, here you cannot apply paint to the obviously to pharynx you can't apply paint. Here you have to give oral tablets of fluconazole. Here you have to give oral tablets of fluconazole. So that is how you will treat oral thrush or oral candida infection. So monoclonal antibody used in asthma, incorrect mechanism. Remember, monoclonal antibodies which are given in asthma, they are only given in corticosteroid resistant asthma. So if asthma is not getting controlled by corticosteroid, then we start monoclonal antibody. And we have monoclonal antibodies, various which have been approved. So first is omalizumab. Omalizumab blocks IgE. So especially if the level of IgE is very high, we prefer to give omalizumab. This question came 2 days before in your FMG exam as well. Mepolizumab and reslizumab, they block interleukin 5. Absolutely right. Then we have dupilumab. Now dupilumab, remember, it does not block interleukin 5. No, it blocks interleukin 4 receptor. And benralizumab blocks interleukin 5 receptor. There is one new monoclonal antibody which has been approved in asthma, that is tezepelumab. Apart from this, No other monoclonal antibody is recommended by guidelines which we follow for asthma. Tezepelumab blocks some thymic stromal lymphopoietin which you don't have to remember. So this is the list of monoclonal antibodies approved in asthma. So a patient presented with cough and thick sputum. Which drug should not be given? Remember, for the treatment of cough, the first class of drug we give is expectorant. Expectorant, remember, they will expel out mucus. How they will expel out mucus? Because these drugs are also known as mucolytic drug. They liquefy mucus and mucus will come out. And these expectorant, remember, they are given for productive cough. Productive or infective cough, so that infection can come outside. So the drugs are ABC, that is ambroxol, bro word is coming, and the bro of ambroxol is bromhexine, again bro word is coming. Then we have a drug which will end with the word cysteine, like N-acetylcysteine, carbocysteine, ildocystine, etc. But another class of drug we are having is antitussive drug. Remember, antitussive drugs, they will act on brain and they will suppress cough center. They will suppress cough centers in brain so that the person should not cough. They are only given in the treatment of dry or non-infective cough. Remember, antitussive drugs should not be given in productive or infective cough. So they are contraindicated here because the infection will not come outside. So the drugs we are having is DON, that is dextromethorphan, very commonly asked question. You should not give in productive or infective cough. Opioids like morphine and codeine, which are addictive drugs also. And very commonly nowadays you will find in cough syrup as noscapine, because dextromethorphan and noscapine are non-addictive drug. Opioids use have been reduced because of addiction. Agreed? So the answer of our question is the patient is having thick sputum. Thick sputum means the person is having productive cough. So you will give expectorant, you will not give antitussive drug. So the answer of our question comes out to be dextromethorphan. Okay. So yes, one student is asking, Chandraji is asking, sir, what about Dornase alpha? Remember, Dornase alpha is an enzyme which degrades DNA, because DNA makes the mucus or sputum very hard. So it's a type of an expectorant and it is only given in the treatment of a disease known as cystic fibrosis. Because in cystic fibrosis, the sputum becomes very hard. Okay. So it's a cystic fibrosis. Apart from guanfacine is a mucokinetic. Okay. Apart from cystic Dornase alpha, you can also give hypertonic saline inhalation also in cystic fibrosis to liquefy mucus. There are plenty of other drugs which you don't have to remember. They will never be asked from you. Okay. In our regular lectures, if you see my series, you can see all the drugs I have told you. Many new drugs, many unique drugs are also there in cough. But remember, for your exam, you just have to remember this one only. Okay. You don't have to do PhD in cough, hai na? So it's better to cough it out on in your exam. Okay. So continuous nitric oxide inhalation. This question came last year, is given for the treatment of which disease? It is given for the treatment of which disease? That is PAH, which stands for pulmonary artery hypertension. So continuous nitric oxide inhalation is given for pulmonary artery hypertension. So which of the following drug is an endothelin antagonist? Endothelin antagonist, these drugs will end with the word entan. Can you tell me why they are ending with the word entan? ENT means endothelin, AN means AN. So bosentan is an endothelin antagonist. Amlodipine is a calcium channel blocker. Selexipag is an IP, I2 type of prostaglandin receptor agonist. And Riosi-Guat, Guat is, it is a guanylyl cyclase activator. Fine. Apart from this, write sildenafil and tadalafil also. Sildenafil and tadalafil, remember, they are phosphodiesterase 5 inhibitor. And apart from this, please write treprostinil. I have given you the mnemonic as well. Eloprost. These are prostaglandin I2 analog. All these drugs are given in the treatment of pulmonary artery hypertension. All these drugs are given in the treatment of pulmonary artery hypertension. Okay. Bosentan is an endothelin antagonist. Now, false statement about Viagra. Remember, Viagra is sildenafil. Agreed? Sildenafil is known as Viagra. So, sildenafil is a phosphodiesterase inhibitor. True. Remember, by inhibiting phosphodiesterase enzyme, it increases cyclic GMP level, and cyclic GMP causes vasodilation. And if it produces vasodilation in lungs, it is given for the treatment of pulmonary artery hypertension. And if it produces vasodilation in penile area like corpus cavernosal blood vessels of penis, it will increase the blood supply to penile area. Increase in blood supply to penile area will lead to penile erection. It is considered to be the drug of choice for erectile dysfunction. It causes blue-green color blindness. Yes, remember sildenafil, it is sometimes known as blue pill. It is sometimes known as blue pill. Agreed? Because it comes, the Pfizer company who makes it, the color of this tablet is blue. And because it's a blue pill, remember it causes blue-green color blindness. You cannot see the color of this pill. Okay. Lastly, we have discussed in cardiovascular system, we should never combine sildenafil with nitrates, and we have discussed the reason also. They will increase to massive increase in cyclic GMP level will happen, and it will lead to massive hypotension and sudden death will happen. Okay, so when a person will start making love to his partner, and everything gets ready, the time of performance come, and if a person takes Viagra before performance, the person suddenly dies, and there is such a tragic death. I think nobody, even our enemy, should not have. Okay, so before making love, suddenly person dies. So imagine how tragic it will be. So person is ready and suddenly dies. This is very bad. So now what is CFTR potentiator, which corrects CFTR channel? Because CFTR channel, cystic fibrosis transmembrane conductance regulator channel, it is defective in cystic fibrosis. So which drug has a mortality benefit? Remember, these drugs, they will end with the word Caftor. They correct this CFTR channel which are defective in cystic fibrosis, and these drugs, they are the new drug for cystic fibrosis, which can even prolong the life of a person. No other drug can prolong the life of a person. So other drugs we can also write Ivacaftor, Lumacaftor, Tizacaftor. So all these drugs, remember, they will end with the word Caftor. There are two new drugs also, but they will also end with the word Caftor only. Okay, remember. Now, where pilocarpine is given in cystic fibrosis to treat dry eyes and dry mouth, which occurs in cystic fibrosis because of blockage of ducts all over the body. Hypertonic saline, it is given for the treatment of, it is used as a mucolytic drug to liquefy sputum, otherwise infection in chest will happen. And pancreas enzyme, which is pancreatic lipase enzyme, it is given for the treatment of chronic pancreatitis, which can occur due to blockage of duct in cystic fibrosis, which can lead to chronic diarrhea or malabsorption. Fine. So all of the following statements are true about second generation antihistaminic, except, remember, there are two types of antihistaminic drugs we have: first generation and second generation antihistaminic. Remember, first generation antihistaminic drugs, they can cross blood-brain barrier. And when they cross blood-brain barrier, remember, they produce sedative effect. Because of this reason, they are sedative. Second generation, they do not cross blood-brain barrier, hence they are non-sedative. First generation antihistaminic drug, they act on brain, and in brain or inner ear, which is the part of brain, they suppress vestibular nerve. That is why they are given for the treatment of various sickness like motion sickness, sea sickness and morning sickness, in which there is vomiting, because it occurs from brain. Here we can't use second generation antihistaminic, and first generation antihistaminic drug, they also have anticholinergic effect, atropine like effect. So second generation, they don't have any of these effect. So what is the use of second generation? Second generation, they only act outside the brain, and outside the brain histamine produces allergic reaction. So second generation, by blocking histamine receptors, they are only used as an anti-allergic drugs. So they are given for rashes, urticaria, pruritus, etc. I hope you have understood the concept. So can you tell me which of the following statement are true about second generation? They do not impair motor performance. False. Okay, true. We are talking about second generation. Yes, because they don't cross blood-brain barrier, they are non-sedative. They possesses high anti-motion sickness activity. False. They cannot be used in motion sickness. They lack anticholinergic effect. True. They may possess additional anti-allergic mechanism. True. So the answer of our question is option number B. In motion sickness, we only give first generation antihistaminic drug. ठीक है, एक्सेप्ट है ना बेटा, एक्सेप्ट है ना. तो false statement we have to identify. Okay, so H1 antagonist or antihistaminic drug have all the function except. So remember, they are antipruritic or anti-allergic, they produce sedation, they are anti-vertigo also, but remember, this is a false statement. Decrease in gastric acid secretion is by H2 antagonist. H2 antagonist, I hope you remember cimetidine, ranitidine, which are used in peptic ulcers. Today we will discuss them also. Remember, they are H2. In stomach, remember, we have H2 receptor, which causes HCl secretion. So the answer of our question comes out to be C. So the long-acting classical first generation antihistaminic drug, which can be given during daytime. Remember, first generation antihistaminic drugs, they are sedative. They are sedative drug. That is why they are contraindicated during daytime. Why we should not give during daytime? It will lead to accidents. But there is one exception to this rule, except chlorpromazine. Chlorpromazine is the only first generation antihistaminic drug which is a least sedative drug, and it can be given during daytime also. So go with the answer chlorpheniramine, because they are asking about first generation antihistaminic. Okay. So a non-sedative antihistaminic drugs are all except. So which drug is sedative? Remember, all second generation antihistaminic drugs, they are non-sedative. Do you agree with this statement? Why? Because they do not cross blood-brain barrier. Again, an exception you have to remember is cetirizine. So cetirizine is the only second generation antihistaminic drug which is a sedative drug. It can cross blood-brain barrier. Now to reduce the sedative action of cetirizine, we made levocetirizine. Levocetirizine requires half dose as compared to cetirizine. So it is less sedative as compared to cetirizine. So you must have eaten cetirizine also. So the answer out here is levocetirizine. So 2 days before a question came, a patient is taking cetirizine for allergy, and the person is experiencing sedation. You are absolutely right. So, which drug we should change? Remember, we must change to a second generation antihistaminic drug, and among them, fexofenadine was in the option because fexofenadine is the overall least sedative antihistaminic drug. It comes with the brand name Allegra. Okay. So, an antihistaminic drug with mast cell stabilizing action. Mast cell stabilizer antihistaminic drug is ketotifen and olapatidine. So they have additional mast cell stabilizing action, and they are given as a topical eye drops and nasal drops. So ENT and ophtha people, they use them very commonly for the treatment of allergic conjunctivitis in eye and allergic rhinitis in eye. To reduce allergy in eyes and nose, conjunctivitis and rhinitis, we can give the eye drops of these drugs. So antihistaminic drug which is given in morning sickness. Remember, morning sickness is nausea and vomiting, which we all know occurs during especially first trimester of pregnancy. Agreed? Now let me tell you, if there is morning sickness in pregnancy, the first treatment is not drugs. Remember, in pregnancy, avoid as much as possible drugs you can, because pregnancy is not a permanent condition, it is just for 9 months. So first treatment is do lifestyle modification in that mother. Tell the mother to have less quantity of plus frequent meals. So eat less but eat frequently, so that again reverse peristalsis should not happen. But if it fails, then you start a drug, and the drug of choice is combination of doxylamine, which is a first generation antihistaminic drug, along with vitamin B6. Along with vitamin B6. So here the answer should be your doxylamine. Remember, all these drugs are given for other sickness like motion sickness and seasickness. Motion sickness and seasickness, we use this drug. Okay. The drug possessing antagonist acting action on both histamine and serotonin. So which drug has both antihistaminic action and anti-serotonin action? The drug name is cyproheptadine. Because cyproheptadine blocks serotonin receptor, it is the only antihistaminic drug which is given in migraine, because serotonin causes migraine. It is also given for the treatment of serotonin syndrome. It is also given in the treatment of serotonin syndrome. So the answer out here is cyproheptadine. Okay. Now, all of the following antihistaminic drugs lack anticholinergic action except. So anticholinergic action is only seen with first generation antihistaminic. It is not seen with second generation antihistaminic. Among them, remember, promethazine has maximum anticholinergic effect. It is the first generation antihistaminic drug. It is the first generation antihistaminic drug. Rest all other drugs are second generation antihistaminics. Okay. Now, two antihistaminic drugs, it has been asked many times. That is terfenadine and estimizole. Remember the names of these drugs by heart. And they were banned. These antihistaminic drugs were banned. They were withdrawn from the market. Why? Because of cardiac arrhythmia. Now, sir, which cardiac arrhythmia they were causing? These two antihistaminic drugs, they were causing QT prolongation. Which cardiac arrhythmia? QT prolongation, which can precipitate a dangerous arrhythmia known as torsades de pointes. Now, why they were causing QT prolongation? Because if their level increases in our body, they can precipitate cardiac arrhythmia because of high level in the blood. So which drugs can increase their blood levels? So remember, any drug which is a CYP enzyme inhibitor will increase their blood level. So when these drugs were combined with erythromycin, their blood levels were increasing. They were causing QT prolongation and torsades de pointes, a very dangerous type of ventricular fibrillation. Patient dies. That is why they were banned. Terfenadine, estimizole. Remember the name. They have been asked many times. So, which drug act on H3 receptor? I think I have told you in autonomic nervous system. And just write inverse agonist. Which drug is a H3 receptor inverse agonist? Approved for the treatment of narcolepsy? The answer is H3 inverse agonist. Approved in the treatment of narcolepsy is tiprolisant. This drug has one more name. It is also known as pitolisant. It is also known as pitolisant. It is an H3 receptor inverse agonist. Fine. Serotonin is synthesized from. So, beta, let me tell you the full name of serotonin. I hope you all know. Serotonin is also known as 5-hydroxytryptamine. Now, can you tell me tryptamine word is coming? So, which amino acid is similar in name with tryptamine? So, which amino acid do you think has a similar name with tryptamine? Four options are given. What is your logical answer for this question? Yes, the answer is it is synthesized from tryptophan. So tryptophan makes serotonin, histidine makes histamine. Histamine is synthesized from histidine. Makes sense to you? Makes sense to you? Tyrosine, we have discussed, it synthesizes catecholamine. It synthesizes catecholamine like dopamine, norepinephrine, epinephrine, they are synthesized from tyrosine. And arginine helps in synthesis of one gas known as nitric oxide. So these are the various molecules which are synthesized from respective amino acids. Okay, that is the question of your physiology also. So sumatriptan is used as a drug of choice for acute attack of migraine. In acute migraine, sumatriptan or triptan are the drug of choice. And we know migraine is a very bad headache. Remember, migraine is a very bad headache. Now, can you tell me, I have given you a statement that migraine is a very bad headache. तो can you tell me in which सर में दर्द होता है? सर में दर्द होता है तो सेरोटोनिन रिसेप्टर इट विल एक्ट बिकॉज सर में दर्द होता है. Serotonin receptor is known as 5-HT bad. Bad means 1B, 1D agonist. So this is a trick how you can remember that sir migraine sar mein dard hai, sar means head, bad headache 1B 1D agonist. So this is a trick. Triptans they act on 5-HT 1B 1D agonist. Okay, any drug which is a triptan is an agonist. What about other drug? 5-HT1A agonist, the drug name is buspirone. And buspirone AA word is coming, it is an anti-anxiety drug. Buspirone is an anti-anxiety drug. 2A word are coming. ठीक है? Then 5-HT3 antagonist. Antagonist means blocker. Remember these drugs, they will end with the word cetron. Like ondansetron, granisetron, tropisetron, they are anti-emetic drug. They reduce vomiting. And any drug which is 5-HT4 agonist, these drugs, they will end with the word pride. They will end with the word pride, like cisapride, prucalopride, etopride. They increase GIT motility. Because they increase GIT motility, they are prokinetic drug which increase GIT motility. Pro means to increase, kinetic means motility. They are given in the treatment of constipation. So I hope you can now remember each of the following drug which act on different receptors of serotonin. So remember, most of the time this question comes, cetrons and pride, where do they act? Cetron, they block 5-HT3. Pride, they stimulate 5-HT4. Okay, understood this part? So let's talk about a hypertensive female with migraine presented to emergency with hypertension, tingling and numbness, skin necrosis in fingers. Very important. So there is dry gangrene of fingers. So vessels are so much constricted that there is loss of pulse also. There is loss of pulse in fingers, tibial pulse. And after that, because of ischemia, there is pain. Obviously, ischemia will lead to pain. And ischemia will lead to necrosis. Ischemic necrosis means dry gangrene. Because of this reason, there is black coloration of fingers. So what we are talking about? Remember, in migraine, if you take ergot, remember a mnemonic, if you take ergot, fingers will rot. Fingers will rot. Because ergots, they produce vasoconstriction in fingers. And this disease is known as ergotism. Ergots, they are just like triptans. They also stimulate 5-HT1B1D receptor just like sumatriptan. Fine. So this is ergotism. I hope you have understood. Don't forget, very commonly asked question. So which of the following drugs are used in prevention or prophylaxis of migraine? Remember four groups of drug backed. Four drugs you have to remember backed. Okay. Prevention of migraine. I am not talking about acute migraine. In acute attack of migraine, we give sumatriptan or any other triptan. For prevention of migraine, we give backed like beta blocker. And beta blocker like propranolol is the drug of choice for prophylaxis or prevention of migraine. But beta blocker, are contraindicated in asthma. In asthmatic individual, remember beta, we either give anti-epileptics or we give calcium channel blocker. Anti-epileptics which are used are three anti-epileptic: valproate, topiramate. Topiramate is a very commonly asked question. And the third anti-epileptic drug which is approved is gabapentin. Gabapentin. Calcium channel blocker, flunarizine. Many times asked, very famous drug given in India. And flunarizine, apart from flunarizine, verapamil can also be given in prevention of migraine. Remember, verapamil given for prevention of migraine, verapamil is also given for prevention of another headache known as cluster headache. Verapamil is also given for prevention of cluster headache also. But what is the treatment of choice for cluster headache? Treatment of choice for cluster headache is 100% oxygen. Treatment is 100% oxygen. Acute attack, we give 100% oxygen. Fine. Lastly, we have TCA. TCA stands for tricyclic antidepressant. So these drugs, they will end with our triptyline, nortriptyline, amitriptyline. I hope you can remember them. The drugs which are used backward, we can easily remember. So what is the answer out here? The answer out here is, okay, which drug is used in prophylaxis? Prophylaxis, the answer is propranolol. Okay. Now remember, sumatriptan, paracetamol, ergotamine, they are given only in acute migraine. Now, if I'll ask you the question, in acute attack of migraine in pregnancy, the safest drug for acute attack of migraine is paracetamol. Avoid giving triptan and ergotamine in, in acute migraine in pregnancy. So, which drug is a CGRP2 blocker used in prophylaxis of migraine? Now, beta, what is CGRP2? Let me write the full form. CGRP stands for calcitonin gene related peptide. Now remember, it is an inflammatory molecule which is released by nerves. Nerves in brain, they release CGRP2. And this CGRP2 is an inflammatory mediator which can cause migraine headache. It can cause migraine headache. So we have to give a drug which will block CGRP2. And the first monoclonal antibody which we made that blocks CGRP2 is erinumab. So erinumab blocks CGRP2. And it is the first monoclonal antibody which has been approved for prophylaxis of migraine. But remember, now we have certain new drug, new CGRP blocker. And these drugs, new CGRP blocker, they will end with our GPANT. They will end with our GPANT, a new class of drug. So like rimegepant, ubrogepant, javigepant, elogepant, both सारे, and gepant you have to understand. So these are the new drugs and they are rather approved for acute attack of migraine. Erinumab is given for prophylaxis of migraine. Erinumab is a commonly asked question. Okay. Now, which of the following calcium channel blocker is used in the prevention of migraine but not in angina pectoris? But not in angina pectoris. Now, let me tell you, verapamil and diltiazem, they both are given in angina. But verapamil, it is also given in migraine also. So verapamil has two use. So answer for this question is, we have discussed flunarizine. The answer of this question is flunarizine. So selective 5-HT4 agonist, useful in treatment of constipation and which lacks arrhythmogenic property is. So remember, any drug which is a 5-HT4 agonist, it will be ending with the word pride. And the first drug which we made was Cisapride. Cisapride got banned because just like terfenadine and estimazole, it was also causing QT prolongation and torsades de pointes. So now the answer of our question comes out to be prucalopride. It is a safe drug. No risk of QT prolongation. So the answer of our question comes out to be D, prucalopride. Pride word you have to understand. So answer out here is, the question is asking which drug does not produce arrhythmia, QT prolongation, lacking. Lacking will be prucalopride. Okay, understood the question properly? Prucalopride acts on which receptor? Separate question. Initial drug of choice for chemotherapy and radiotherapy induce nausea and vomiting. So when we give chemotherapy and chemotherapy induce nausea and vomiting, radiotherapy induce nausea and vomiting. Remember, when we give anti-cancer drug or radiotherapy, they kill GIT cells. And killing of GIT cells, because they are rapidly dividing cells, releases inflammatory mediator like serotonin and other molecule, which goes on brain and stimulate vomiting center. It can lead to vomiting in anti-cancer patient. Now, overall drug of choice for chemotherapy-induced nausea and vomiting is cetrons. That is 5-HT3 antagonist. But remember, they are only effective up to 24 hours. Up to 24 hours means they are only effective in early phase of chemotherapy-induced nausea and vomiting. If the vomiting occurs beyond 24 hours, which is known as delayed phase, then we give other drugs. So here the drug of choice is granisetron. Now if vomiting occurs beyond 24 hours, then the drug of choice is pitants. Now not cetron. Now you will give pitant like drug. And these pitant, they block neurokinin, which is, let's make the short form of neurokinin as NK1 receptor. They block NK1 receptor, last year question. So any drug you can see ending with the word pitant, apripitant. Okay. So it is given in delayed phase of nausea and vomiting. Where hyoscine is given? Hyoscine is given in motion sickness. Lorazepam is given for anticipatory vomiting. Anticipatory vomiting means when a person is having fear. Let's say tomorrow is surgery. Yeah, let's say after 30 minutes, a person is having surgery. Patient can have vomiting. A person suddenly sees dead body. Person vomits. That is anticipatory vomiting. Now, if pitants are not effective, if there is resistance to pitant, then we add a drug dexamethasone. And if it is still resistant, then we add cannabinoids. Remember, cannabinoids like bhang, charas, ganja, they are also anti-emetic drug. And these drugs, they stimulate cannabinoid 1 receptor, CB1 agonist. These drugs will have NABI word in them. NABI word will come. Dronabinol, nabilone. So both of these drugs, they are having NABI word in them, because NABI word is also coming in cannabinoids. So remember, NABI wale drug, they are given in resistant cases of chemotherapy induced nausea and vomiting in delayed phase. So this is the whole treatment, and this is a very important chart that we have made. Understood this part? So tell me the answer of this last year question. This same exactly last year question. Apripitant. Pitant word is coming. So it is NK1 blocker. Antagonist, not agonist, and not 2 receptor. Yes, olanzapine can be given. I have told you, but to make things simpler so that you can revise them for NEET exam, I have made them in a much more simpler way. Even domperidone has been tried, prochlorperazine has been tried, many drugs have been tried. Okay. Now, false about dronabinol. Nabi word is coming beta word. So tell me, is it used in refractory cases of vomiting due to anti-cancer drug? Yes, true. Dronabinol. It is used in delayed phase of vomiting? True. It is a CB2 agonist? No, this is a false statement. It is rather stimulating which cannabinoid receptor? It is CB1 agonist. Now you know that when you take cannabinoids like bhang, charas, ganja, it stimulates appetite. A person eats a lot. So yes, which anti-emetic drug stimulates appetite? Dronabinol. It stimulates appetite. Dronabinol. So now a patient presented to emergency with vomiting, with reduced bowel sounds, and in turn gave an injection of anti-emetic drug that suddenly led to muscle spasm, upward gazing of eye. Let's call them upward gazing of eyes as oculogyric crisis. Gyric is a part of brain, so person is seeing towards brain. Let's remember like this. And patient is having slowing of body movement, and a person is having walking problem, gait abnormality. Tell me what is happening first. Yes, the patient is suffering from drug induced Parkinson disease. So the patient is suffering from drug induced Parkinson's disease. So in Parkinson disease, remember the patient has muscle spasm. Let's call this disease as muscle dystonia. Muscle tone increases. And we know drug induced Parkinson disease occurs because of blockage of which receptor? It occurs because of blockage of dopamine receptors in brain. So which anti-emetic drug blocks dopamine receptor and can lead to drug-induced Parkinson disease? The answer is metoclopramide. So this anti-emetic drug implicated in this case is metoclopramide, which is causing this problem. And apart from metoclopramide, remember we have discussed in CNS chapter that antipsychotic drugs can also cause drug-induced Parkinsonism. Fine. Okay. So, what is the treatment? The treatment for this condition is we give anticholinergic drug, and the drug of choice is benzhexol. The treatment is benzhexol. Other drug you can give like benzhexol is benztropine. You can also give benztropine. You can also give promethazine. They also have anticholinergic effect. So these are anticholinergic drug which are given for the treatment of drug-induced Parkinsonism. So the drug implicated out here is metoclopramide. Haloperidol and risperidone, remember they are antipsychotic drugs. They can also cause drug-induced Parkinsonism. Okay? Okay? So which of the following helps in maintaining the patency of ductus arteriosus? So remember, ductus arteriosus, let's talk about ductus arteriosus. If you want to keep it patent, or you want to close it, close PDA, patent ductus arteriosus. To keep it patent, you give prostaglandin E1. Prostaglandin, keep it patent. Remember like this. Okay. Okay. So the answer is L-prostadil. L-prostadil. Fine. To close it, we give NSAIDs, non-steroidal anti-inflammatory drug, because they decrease prostaglandin production. So the overall drug of choice is ibuprofen, which is the overall drug of choice. But the most commonly used drug is indomethacin. Okay, the most commonly used drug is indomethacin. So answer out here would be your prostaglandin E1. Fine, prostaglandin E1. Fine. So which of the following prostaglandin is given for NSAID-induced peptic ulcer like aspirin-induced peptic ulcer? Remember, any peptic ulcer drug of choice is PPI. But you can also give misoprostol. And remember, misoprostol is again, just like L-prostadil, it is also prostaglandin E1. Now, misoprostol, remember, it is also the drug of choice to induce medical abortion or MTP up to 63 days of pregnancy. You can give misoprostol. Carboprost is prostaglandin F2 alpha. It is given to control PPH, postpartum hemorrhage, in oxytocin resistant cases. In oxytocin resistant cases. Latanoprost is also a prostaglandin F2 alpha, which is given as an eye drops, and it is given as a drug of choice for the treatment of glaucoma we have discussed. Epoprostinol is PGI2. It is given in pulmonary artery hypertension. So these are the various uses. Fine, fine. So a pregnant woman was prescribed indomethacin. Tell me the answer of this question. Which of the following effect it will have? Drug effect on fetus. So if a female is taking non-steroidal anti-inflammatory drug in pregnancy, why they should be avoided in pregnancy? In pregnancy, we only give paracetamol, no other drug, because it can lead to premature closure of ductus arteriosus in fetus. It can lead to so avoid giving NSAIDs in pregnancy. Mobius syndrome is an adverse effect of, remember, Mobius syndrome is a teratogenic effect. There is malformation of cranial nerves. There is malformation of cranial nerves. Most common nerve which is involved is sixth cranial nerve. And the drug which can lead to is misoprostol. Misoprostol can cause Mobius syndrome. It's a teratogenic drug in pregnancy. So if there is incomplete abortion with misoprostol, you cannot continue pregnancy because it will lead to teratogenic effect. Now you have to find other methods of inducing abortion. Okay. So which of the following drug reduce the activity of phospholipase A2 enzyme? So remember, this is a cell membrane, and we all know cell membrane contains phospholipids. From phospholipids, arachidonic acid is produced. And from this arachidonic acid, prostaglandins are produced. The first enzyme which is required is phospholipase A2. A2 means it makes arachidonic acid. And the second enzyme is cyclooxygenase enzyme. And remember, prostaglandin produce inflammation in our body. Remember, prostaglandin produce inflammation in the body. So the first drug which inhibit phospholipase A2 are the best anti-inflammatory drug we have is corticosteroids. So these are steroidal drug. They inhibit phospholipase A2, and the drug which is a corticosteroid is prednisolone. The answer is prednisolone. And the drug now which will inhibit COX enzyme is non-steroidal anti-inflammatory drug. Why we call them as non-steroidal anti-inflammatory drug? Because unlike corticosteroid, they are non-steroidal drug. They don't produce Cushing syndrome. So NSAIDs like aspirin, ibuprofen, so they are NSAIDs. Okay, so NSAIDs, they inhibit which enzyme in our body? Non-steroidal anti-inflammatory drug. They inhibit cyclooxygenase enzyme. They inhibit the conversion of arachidonic acid into prostaglandins. Fine. So all of the following NSAIDs are reversible inhibitor of COX enzyme, cyclooxygenase enzyme, except the answer is aspirin we have discussed. Aspirin is the only drug which is an irreversible cyclooxygenase inhibitor. So any drug you know which is an irreversible inhibitor is also known as, anyone who can remember general pharma and tell me, I have just told you. They are also known as hit and run drug. Any drug which is a irreversible inhibitor is also known as suicide inhibitor. These are the further questions you have to remember. Okay, further questions you have to remember. So I hope you understand the concept behind it. These are the topics we most of the time leave before exams, but question comes very commonly. Now, aspirin in children with viral disease, it can lead to it can lead to acute liver failure or acute liver damage. And if there is acute liver damage, it can lead to increase in ammonia level. Ammonia level will damage brain. So aspirin in children in presence of viral fever can lead to liver damage. This syndrome is known as race syndrome. This syndrome is known as race syndrome. So the answer of our question is race. Because of the risk of race syndrome, remember aspirin is contraindicated in people less than 18 years of age. We don't give aspirin in less than 18 years of age because of the risk of race syndrome, except in two conditions. Except in which two condition aspirin can be given in children? Aspirin is the drug of choice for prevention of rheumatic fever or rheumatic heart disease. We give in children for rheumatic heart disease. And aspirin is given in children in a disease known as Kawasaki disease. So only two condition where we give aspirin in children is because these are very dangerous disease. So if we have to have a balance of, if you want to have a balance of risk versus benefit, these are dangerous disease. So rheumatic fever was asked recently, 2 days before. For the pain control in patient who is having history of GIT ulcer and bleeding, which of the following drugs should be given? Even this question came 2 days back in FMG exam. So which drug should be given in the patient of peptic ulcer? So remember, in peptic ulcer, the drug which is safe is Coxips. The drug which is safe is Coxip. Coxips are selective COX-2 inhibitor. They only inhibit COX-2 enzyme. In stomach, we have COX-1 enzyme. So they will spare stomach, they will not produce peptic ulcer. So the answer out here was Rofecoxib, but 2 days before the option was having Celecoxib. 2 days before the answer which was asked was Celecoxib. Okay. Now a 33-year-old child presented to OPD with symptoms of COVID-19 virus. Aspirin is contraindicated in COVID because of the risk of race syndrome. Because of the risk of race. That is why we haven't used aspirin during COVID virus. We rather used paracetamol. So no risk of race syndrome is seen with paracetamol. So that is why we use paracetamol. But if any other option will come, you will go with ibuprofen. So which drug will not produce race syndrome? Paracetamol or ibuprofen? Fine. So match the following adverse effect of NSAIDs. Now remember, Coxips, I have told you they are good for peptic ulcer. They will have no risk of causing peptic ulcer, but certain Coxips are very dangerous. Coxips, remember, they can increase the risk of MI, stroke and thromboembolism. That is why Rofecoxib and Valdecoxib, they got banned. Nimesulide also got banned because nimesulide, it was having a risk of Steven-Johnson syndrome and hepatotoxicity. Aspirin, we already know, causes race syndrome. And samtostride, what is that? I will tell you. And lastly, remember that indomethacin has a side effect of seizure and sedation. Now, what is samtostride? Samtostride is aspirin increasing the risk of allergic reaction. Allergic reaction in bronchus is asthma, and allergic reaction in nose will lead to ethmoidal polyp in nose. So this triad is known as Samter's triad. Why? Because aspirin inhibit COX enzyme. Because aspirin inhibit COX enzyme, it will increase the activity of LOX enzyme. LOX stand for lipooxygenase enzyme, and lipooxygenase causes allergic reactions, allergic disease. So because aspirin inhibit COX, LOX pathway becomes activated, lipooxygenase pathway will lead to allergic reaction. This triad is known as Samter's triad. So safest analgesic, wherever the word safest painkiller comes, what should be your answer? Whether it is child, whether it is pregnancy, whether it is peptic ulcer, whether it is race syndrome, risk of race syndrome. So can you tell me the time and tested drug, whether it is renal failure or renal stone, always the safest drug is paracetamol. Paracetamol is also known as acetaminophen. Another name of paracetamol is acetaminophen. Fine. Now, what is the toxic form of paracetamol? Remember, the toxic form of paracetamol is produced in liver, and the toxic form of paracetamol in liver is NAPQI, and this NAPQI produces hepatotoxicity. It produces hepatotoxicity. And what is the antidote of paracetamol toxicity? The antidote for the treatment of paracetamol toxicity is sorry, here the answer is A. The antidote is N-acetylcysteine. How N-acetylcysteine acts? N-acetylcysteine increase glutathione level in liver, and this glutathione remove NAPQI. N-acetylcysteine increases glutathione level. Glutathione removes NAPQI. Fine. Napkin. Very good. Napkin. So how this paracetamol causes hepatotoxicity? The pattern of hepatotoxicity I have explained you in regular lecture in great detail. It causes centrilobular necrosis. So liver, it leads to centrilobular or central. The cells around central vein in liver will become dead. And it can occur with acetaminophen, which is also known as paracetamol overdose. And it can be prevented by which molecule? It can be prevented by N-acetylcysteine. Fine, N-acetylcysteine. And we know how they act. We have already discussed sodium nitrite and amyl nitrite. They were given in cyanide poisoning. And dimercaprol we have discussed yesterday. It is a chelator given for mercury. It is also known as BAL, British anti-leucite, given in chelators. Now, NSAIDs which lack anti-inflammatory action is paracetamol. Remember, paracetamol is only analgesic, that means pain reliever, plus antipyretic. Antipyretic means fever reduce. It will reduce fever. It does not have any anti-inflammatory action. The reason is paracetamol, it acts on brain only. Paracetamol only acts on brain. And on brain, the exact mechanism still we don't know of paracetamol. It is said that it inhibits COX-3 enzyme and it stimulates a receptor known as TRPV1 receptor. So question has been asked. So it does not act outside the brain. That is why it does not reduce inflammation in the body. Okay. Raju, a 30-year-old male, presented to OPD with sudden onset of swelling and redness in first metatarsophalangeal joint. Can you tell me which disease we are talking about? Metatarsophalangeal joint is the most common joint involved in gout. Gout. The patient is having gouty arthritis. A needle aspirate shows negatively bifringent crystals of uric acid. Uric acid, when deposited in gout, it shows negatively bifringent crystals, which is suggestive of gouty arthritis. Now, the physician prescribed a drug to the patient, and the patient came back next day with nausea, vomiting, and diarrhea, and low WBC count after taking the medication. So, which of the following drug was most likely to be given? So, can we say the patient is having low WBC count? Low WBC count means bone marrow suppression. Remember, bone marrow suppression can be seen with allopurinol and colchicine. Both drugs can cause bone marrow suppression, but allopurinol is given for long-term treatment of gout, chronic gout, while colchicine is given during acute attack of gout. Now tell me, out of A and B, which option you will choose? Which option you will choose? Remember, the patient is having acute attack of gouty arthritis. So the answer out here is colchicine. Both these drugs can cause bone marrow suppression. Okay. So the answer out here is colchicine because the patient is having acute attack of gouty arthritis. So mechanism of colchicine in acute attack of gout. Remember, colchicine is a microtubule inhibitor. Remember, microtubules are required for movement of WBC. So it inhibits migration of WBC. So the answer out here is it inhibits migration of WBC. That is why it has anti-inflammatory action in acute attack of gout. To reduce inflammation in acute attack of gout, we give colchicine. Now remember, microtubules, they also make spindle fibers. So it is also a spindle poison. Spindle poison means it will inhibit cell division. Because it inhibits cell division, the side effect of colchicine will be bone marrow suppression, because bone marrow cells are rapidly dividing cells. Agree? It is also used as a spindle poison for karyotyping, because in karyotyping we have to arrest the cell cycle, we have to inhibit cell cycle so that we can see the shape of and count the number of chromosomes. That's great. Allopurinol and febuxostat are inhibitor of. Remember, febuxostat, exo word is coming. Can you tell me the answer? So allopurinol and febuxostat are xanthine oxidase inhibitor. They are xanthine oxidase inhibitor. And these drugs are the drug of choice for chronic gout. So remember, in chronic gout, you have to reduce blood uric acid level. In acute gout, you have to reduce inflammation. In chronic gout, you have to reduce blood uric acid level. So certain causes of chronic gout. The first cause of chronic gout is CKD, chronic kidney disease. We give allopurinol and febuxostat. They are also given in tumor lysis syndrome. They are also given in tumor lysis syndrome. When the tumor cells die, their DNA gets converted into uric acid. Okay. Now, the point is, in allopurinol and febuxostat resistant cases of chronic gout, in resistant cases, remember, we give pegloticase or rusp-uricase. Now, what is pegloticase and rusp-uricase? Remember, they are ACE word is coming. They are enzymes which oxidize or degrade uric acid. So they are uric acid oxidizing enzyme. So they are uric acid oxidase enzyme. Allopurinol inhibit the production of uric acid. If uric acid is already produced, let's say it's a resistant cases, then directly degrade uric acid by enzymes like pegloticase and rusp-uricase, because pegloticase and rusp-uricase convert or degrade uric acid into a harmless molecule known as allantoin. Allantoin is harmless. So tell me the answer of next question. Which drug degrades uric acid into allantoin? So the answer out here is rusp-uricase. Agreed? Rusp-uricase. What about probenecid? Probenecid increase the excretion of uric acid into urine. That is why it is known as uricose uric agent. It is uricose uric agent. Now you know all the drugs. Okay. So which of the following drug increases uric acid excretion in urine? The answer out here is probenecid. Fine. Now allopurinol increase the toxicity of which drug? Remember, xanthine oxidase enzyme, I think we have discussed, converts purines into uric acid. Agreed? And you can see a name, allopurinol. Can you see the name? Why allopurinol is having purine word in it? because it is similar to purines, but it is a fake purine. It is a fake purine. It inhibits xanthine oxidase enzyme. Now, can you tell me which drug will not be degraded by? Which drug is also a purine, which will which will not be degraded? Yes, we have discussed 6 mercaptopurine. It is a fake purine, and another fake purine is azathioprine. But let me write azathioprine. It is also a fake purine. So it increased the toxicity of allopurinol, increased the toxicity of these two drugs. So I hope you have understood the trick behind it. Understood the trick behind it. So purine word you have to identify. Allopurinol, purine word will come in them also. Okay. Okay. So all of the following drugs, see, question can be asked in a simple way or in a tough language. If your concepts are strong, the question will never, you will never feel the question will be tough. Okay. To save time, I have condensed the question. I have reduced the language of the question. But anyway, they will be asking you same thing in a twisted way. So if your concept is strong, read the question properly. Definitely, nothing will come out of it. Okay, nothing will come out of it. NHB04. All of the following drugs can be used in the treatment of hyperuricemia except uricemia means gout. The answer is aspirin. Okay, so the answer out here is niacin. Remember aspirin in high dose. Now, just a second, beta. Just a second. Just a second. The answer of this question is phenylphiprid. Remember aspirin, pyrazinamide and niacin, they increase uric acid level. They are bad for gout. They are bad for gout. But if we will write phenylphiprid, statins and losartan, these three drugs, they decrease uric acid level. They are good for gout. They are good for gout. So niacin is bad for gout because it increases uric acid level. I think we have discussed in blood chapter. The physician wants to add a DMARD. DMARD stands for disease modifying anti-rheumatic drug. So where they will be used? Disease modifying anti-rheumatic drugs. They are given for the treatment of rheumatoid arthritis. And this drug inhibits pyrimidine synthesis by inhibiting an enzyme dihydroorotate dehydrogenase. Let me write the short form of this enzyme, DOD. Which of the following drug the physician is thinking? The answer of this question is leflunomide. So leflunomide inhibit dihydroorotate dehydrogenase enzyme, which will reduce pyrimidine production and it will inhibit lymphocytic division, immunity will fall, and it will be effective in the treatment of rheumatoid arthritis. Infliximab, remember, inhibit TNF alpha. It's a monoclonal antibody against TNF alpha given in rheumatoid arthritis. Abatacept inhibit interleukin 1 receptor given in rheumatoid arthritis. So, okay, so all these drugs are given in the treatment of rheumatoid arthritis. So which of the following disease modifying anti-rheumatic drug, which is also known as DMARD, is the first drug of choice? Now understand this question. Here the answer is methotrexate. Methotrexate is the drug of choice for RA. Why? Because it is the most effective drug. Fine. So let me tell you the treatment of rheumatoid arthritis. So in the rheumatoid arthritis, if the patient is having acute arthritis, we give NSAIDs, non-steroidal anti-inflammatory drug. And in non-steroidal anti-inflammatory drug resistant cases, we can give corticosteroid as an injection directly into the joint. But for long-term treatment is we have to prevent joint destruction. We have to prevent joint damage which can occur in rheumatoid arthritis. We have to give DMARDs, that is disease modifying anti-rheumatic drug. And the overall drug of choice is methotrexate. I'll write the short form methotrexate. Now remember, methotrexate, it is contraindicated in pregnancy because it is an antifolate drug, folic acid inhibitor. It will lead to neural tube defects. In pregnancy, we prefer to give hydroxychloroquine. Hydroxychloroquine, safer drug in pregnancy for rheumatoid arthritis. And we can also add sulfasalazine. First point, I hope you have understood. Now, in methotrexate resistant cases, add other DMARD. With this methotrexate, we can add other DMARD like infliximab and etc. new drugs. Infliximab, I have just told you, anti-TNF alpha. You can add any of the other drug in methotrexate resistant cases. So I hope you have understood the concept how to treat rheumatoid arthritis. Okay. So which of the following DMARD is the drug of choice in pregnancy? Now tell me the answer. This was the last year question. What is the answer, beta? Anyone? What is the answer? Yes, tell me the safest drug. In acute gout, first we start with NSAIDs, not control, we give colchicine, still not control, we give corticosteroid. Okay. So answer out here is, and remember, methotrexate is absolutely contraindicated in pregnancy. Which category of drug? It is category X drug. Absolutely contraindicated because it can cause neural tube defect, and same thing is seen with leflunomide. They both are antifolate drugs. Okay. So which of the following DMARD increase the risk of reactivation of TB? Remember, TB, it is found inside macrophages. You know, TB is present inside the macrophages, but this TB is latent. Latent means it is sleeping, it is not dividing inside the macrophages. Why? Because, sir, macrophages, they produce TNF alpha. They produce TNF alpha, and TNF alpha suppress the growth of TB. That is why most of we Indians, we harbor TB, but in our life, most of the time in our lifespan, TB does not becomes reactivated. So the answer of this question is infliximab. Infliximab is an anti-TNF alpha. So it can lead to reactivation of latent TB. That is why before giving infliximab in Indian population, do MONTU test, or you call this test as PPD test, purified protein derivative test, to check whether the patient is having latent TB or not. If the patient is not having latent TB, only then we give infliximab. Otherwise, we never give infliximab if the MONTU test is positive. Okay. So tocilizumab acts by. So tocilizumab blocks interleukin 6. It is given in the treatment of RA. It is given in the treatment of rheumatoid arthritis. The drug that block interleukin 1 is anakinra. Anakinra. RA word is coming in anakinra. The drug that blocks CD20, rituximab. Ritu, I told you there is a girl named Ritu whose age is 20 years. The drug which blocks JAK-STAT enzyme is tofacitinib. All these drugs are given in treatment of RA. They are disease-modifying anti-rheumatic drug. They all are disease-modifying anti-rheumatic drug. Remember, tofacitinib, it is also approved for IBD. IBD stands for ulcerative colitis and Crohn's disease. This was a recent question. Tofacitinib is also approved for inflammatory bowel disease. Now let's talk about the last part, the questions of GIT. So we are done with respiratory system and Autacoids. Let's talk about now GIT, the last part. So omeprazole, remember prazoles are the drug which are known as PPI, proton pump inhibitor. And proton pump in chemistry, H plus is known as proton pump. H plus is known as proton pump. So it inhibits hydrogen potassium ATPase as an irreversible fashion. So proton pump inhibitor, any drug ends with the word prazole will inhibit hydrogen potassium ATPase pump in stomach. Fine. Any drug which inhibits sodium potassium ATPase is digoxin. Remember, digoxin acts on heart. Okay. PPIs, they act on stomach. Don't confuse with hydrogen potassium and sodium potassium ATPase. Fine. So which drug blocks M1 receptor? M1 stands for muscarinic 1 receptor of acetylcholine. And that drug is used in peptic ulcer. I hope we have discussed. Yes, the drug name is pyranzapine and tilinzapine. They were earlier used in peptic ulcer. Nowadays, since we got proton pump inhibitor, these drugs are now out of use. They are very less effective drug. But it has been asked last year as a question, pyranzapine and tilinzapine. On chronic use of which of the following drugs can cause reversible gynecomastia? So I have already told you gynecomastia is caused by which drug? Disco. I have told you previously, disco drugs, they can cause gynecomastia. And in disco, the C word stands for cimetidine. So cimetidine is a histamine 2 receptor blocker. So long-term use of proton pump inhibitor is not associated with. It's a tough question. Which of the following? Remember, if you use proton pump inhibitor for very long duration of time, they will decrease HCl production. And decrease in HCl production will increase the risk of infections because HCl protects from infection. And they will also lead to deficiency of vitamins and minerals. Deficiency of vitamins and minerals. Do you agree with this part? So tell me the answer. Keeping this thing in mind, do proton pump inhibitor Do proton pump inhibitor increase the risk of community acquired pneumonia? Yes, they increase the risk of community acquired pneumonia. Do they increase the risk of Clostridium difficile infection? True. They increase the risk of Clostridium difficile infection. They can also lead to iron, calcium, magnesium, and B12 deficiency because these ions are dependent upon HCl for their absorption. Now, because of long-term calcium deficiency, PPIs, they increase the risk of osteoporosis and fractures in women. Remember this part, PPIs, they can increase the risk of fractures. So the answer of our question is false statement is hypothyroidism. Now this is a false statement. Fine, false statement. Which group of drug is most effective in treating or healing NSAID-induced peptic ulcer? Remember, any cause of gastric ulcer or peptic ulcer, any cause, the drug of choice is always and always PPI. But misoprostol can also be used. But the drug of choice is always PPI. Fine. Which antacid can be given in a patient of chronic renal failure? Remember, in chronic renal failure, patient has weak bones. The patient suffers from osteoporosis because of weak bone. Can you tell me the answer of this question? Which antacid you should give? Now tell me the answer. You know the answer. Weak bones are because of deficiency of calcium. Yes, your answer should be your calcium bicarbonate. Fine. Very good. Next, antacids which causes diarrhea. Now this is a very important question. Remember, antacid which causes diarrhea is magnesium sulfate. Remember, MD. Magnesium causes diarrhea. That is why magnesium is also used as a laxative drug. Laxative drug means to treat constipation. Aluminium and calcium, remember, they cause constipation. So the answer out here is magnesium. Magnesium causes diarrhea. So the following appears to be affect the integrity of adherent gel of sucralfate interfering with its action. Now remember one point. Just ignore this question, incorrectly framed question. Now, sucralfate. What is sucralfate? Remember, sucralfate is an ulcer protective drug. It is an ulcer protective drug. Suppose in stomach there is an ulcer. Let's say in stomach there is an ulcer. Sucralfate, it will come and it will make a protective covering over ulcer. It will cover the ulcer. This is what sucralfate is. So sucralfate is an ulcer protective drug. Now remember, sucralfate should be avoided with certain molecules. Now sucralfate should be avoided with it should be avoided with antacids, because sucralfate require acidic pH, antacids will increase pH. So there should be a gap of sucralfate and antacid 30 minutes. With food, a person should not eat anything if a person is taking sucralfate for next 60 minutes. And with other drugs, their absorption will be reduced by sucralfate, phenytoin, and ranitidine, because sucralfate can reduce the absorption of these drugs. So now tell me the answer of this question. This question was asked in NEET exam. So what is the answer? Here the question is phenytoin. So the gap should be of 120 minutes. Here the answer should be your D. Because here phenytoin is asked. If antacid is asked, 30 minutes. If food is asked, 60 minutes. If other molecules are asked, then you know the answer is this one. Now next question is, all of the following antibiotic have been used in the treatment of H. pylori except. So remember, for the treatment of H. pylori, remember a mnemonic Camtel. These antibiotics are given Camtel. C for clarithromycin, amoxicillin, metronidazole, or any drug that ends with the word nidazole like ornidazole, tinidazole, tetracycline, and levofloxacin has also been approved. So these are the antibiotic for H. pylori. What is the answer? Remember, ciprofloxacin is not used. It is rather levofloxacin which is used. And the most common regimen which we give for H. pylori is PCA and PCM. So PCA stand for PPI plus clarithromycin plus either amoxicillin or metronidazole combination. This is known as triple regimen. Most commonly we give for the treatment of H. pylori. This is known as triple therapy. Now, which prokinetic drug has action without D2 blockage? Prokinetics are the drugs which increase GIT motility, And prokinetic drug, because they increase GIT motility, they are given for constipation, because they increase intestinal motility. They are also given in the treatment of GERD, gastroesophageal reflux disease, because they prevent reflux of stomach content back into the esophagus. Now let me tell you, any drug which ends with the word pride, we have discussed, it is serotonin 5-HT4 agonist. Domperidone is D2 antagonist. It is also a prokinetic drug given in GERD. Metoclopramide has both action, 5-HT4 agonist plus D2 antagonist. So it has both action. Now tell me the answer of this question. Yes, the answer of our question is Cisapride. Now can you tell me two prokinetic drugs which are having dopamine receptor blocking property? Domperidone and metoclopramide. Okay, domperidone and metoclopramide. Metoclopramide can cross blood-brain barrier. Domperidone do not cross blood-brain barrier. Can you tell me which drug was causing Parkinson disease? No risk of Parkinson disease is seen with which drug? No risk of Parkinson disease is seen with domperidone, and we have previously discussed that metoclopramide causes Parkinson disease. Treatment is benzoxazole. So which of the following purgative means any drug which is a laxative and laxatives, they are given for the treatment of constipation, which increases fecal bulk laxative, because their bulk increases due to water absorbing capacity and retaining capacity. The answer of this question is methyl cellulose. So methyl cellulose, psyllium, you have heard about the word isabgol, ispagula. These drugs are known as bulk laxative, and bulk laxative are the drug of choice for the treatment of constipation. Lactulose is a osmotic laxative, and lactulose, I have told you, is the drug of choice in liver disease. I hope you remember that concept. Hepatic encephalopathy, it reduces ammonia absorption. Remember paraffin. Paraffin is a waxy molecule, है ना, waxy molecule. And DOS. These two molecules are known as stool softener. They are known as stool softener. They are given to avoid straining or pressure while defecation. Okay. So which of the following laxative lowers ammonia level in hepatic encephalopathy? So hepatic encephalopathy, liver disease. Can you tell me in liver disease the laxative of choice is lactulose? And I have told you two antibiotics also which are given in hepatic encephalopathy. Okay. So bulk laxative are the drug of choice for constipation due to any cause, whether it is IBS, irritable bowel syndrome, idiopathic constipation, constipation in pregnancy. Always start with bulk laxatives like isabgol. Now, what is bisacodyl? Remember, bisacodyl is a stimulant laxative. So, bisacodyl is a stimulant laxative. Bisacodyl. It directly stimulates intestinal muscle. Senna is also a stimulant laxative. What about osmotic laxative? In osmotic laxative, remember sodium phosphate. It is an osmotic molecule, sodium. Instead of sodium, you can write magnesium. Magnesium also. Mannitol and lactulose. They are osmotic laxative. And one very important drug is PEG, polyethylene glycol. So they are given for whole bowel irrigation. Now, whole bowel irrigation should be done before colonoscopy to clean the bowel. And now the drug of choice before colonoscopy to clean the bowel has become PEG. Now the drug of choice has become PEG. Before colonoscopy, which laxative you will give? PEG, polyethylene glycol. Okay. Now, which laxative acts by opening of chloride channel? So chloride channel opener is lubiprostone. It is a chloride opener. What about tenapanor? Na word is coming. It inhibit, it close, or you will write, it block sodium hydrogen antiporter. Both these laxative, they are used for the treatment of irritable bowel syndrome, which is associated with constipation. So constipation, predominant IBS, we give this. These are the new drugs for irritable bowel syndrome. New drugs. So which drug causes melanosis coli? Melanosis means blackening of colon. So if there is blackening of colon, you cannot do colonoscopy after that. So which drug causes blackening of colon? Senna. Senna causes blackening of colon. So which of the following drug is useful in dissolving gallstones? So the drug which is useful for dissolving gallstone is ursodeoxycholic acid. You can also use obeticholic acid. So these drugs are sometimes used for dissolving gallstone. Agreed? So this finishes our lecture of miscellaneous all topics, and this finishes our series as well. So I hope you enjoyed, you learned something, you made your concept stronger with this series. I wish you best of luck for your upcoming exam. I hope that you all will do best of, you will give your best of your capability, what you have learned. Remember, give what you know, do best in your exam, don't be stressed with the result of the exam. Okay, result is not in your hand. So this is all from my side. Share with your friends so that they should also get benefit of this series, and don't take any type of stress in the remaining days before your exam. Okay, don't take any type of stress. Okay, you have already done enough in your life. You have cleared MBBS, you are doing MBBS, so you already are intellectual people. Okay, so don't worry about anything. Remember, life is very big. Life has many other aspects. Life has other goals also. Remember, surely if your mind remains calm, you can clear any exam you want. अगर आपका mind शांत है, okay? If you are under your full control, you feel that I am under my control only, you will clear any exam. Okay? Okay? No, no, beta, NHB04. It is not that we will share after the exam. No, don't work like this. Okay. The more you share, the more wiser you will come. Okay. So, knowledge is always meant to share. Okay. So, share with your friends. They should also get help. So, don't do anything to others which you don't like, should not happen to you. Okay. So, this is what morality is all about. Thank you very much. Enjoy. So, I'll share this PDF, and rest is now your turn. Give your exam, do your best, forget about the result. Okay, thank you very much. Okay, okay, NH. I know fun is important. Okay, I know you are joking. Chalo. Best of luck, best wishes. You have any questions, you can ask me. These are the barcodes I have posted in this PDF. You can ask on Insta, Facebook, anywhere you want. Okay, if you still have any doubt, you can ask me. Okay, I'll help you out. If you find any question difficult to understand, why the answer is not this, not that, है ना? चलो. Okay, thank you, NHB04. Thank you. चलो, thank you.